So hello everyone, and welcome back to the PrepWell video podcast series, and today we're talking all about sleep. So we've already heard from Professor Jerry Darnjou in an earlier podcast who gave us an overview of the PrepWell programme and what it's all about, but today we're going to hear from him in his other capacity as a sleep medicine specialist. So Jerry, I think it's maybe fair to say that sleep is maybe underestimated in the UK as a component of people's overall health. We hear in the news frequently that adults in the UK significantly suffer with sleep problems. I think recently 1 in 3 on BBC News. And there's lots of interest increasingly about how we can improve our sleep health to affect our overall health and well-being. And we're increasingly realising, I think, that this is something that's important around the time of surgery too. So I want to start by asking, how common are sleep issues in patients who are preparing for surgery?
Common is the answer, James, to that. Obviously, there's a whole spectrum of sleep disorders, from people who struggle to get to sleep, what we know as insomnia. And if you struggle to get to sleep, that's known as initial insomnia. People who wake up frequently through the night and struggle to get back to sleep. And obviously, there are a variety of reasons why that can occur. And also there are people with other sleep disorders such as obstructive sleep apnea, which is a condition where you usually snore heavily and repeatedly narrow or block your airway during sleep and drop the oxygen levels in your body, and that can also be a risk factor, for example, for surgery. So just to encapsulate that, or to put some perspective on that, we estimate since the start of the COVID-19 pandemic that up to 1 in 3 adults is struggling with insomnia, and we know that up to about 1 in 5 or 1 in 6 adult males presenting for surgery over 50 suffer with obstructive sleep apnea. So it's common.
Yeah, absolutely. So if you are someone who has difficulties with sleep, and as you've already described to us, maybe that's difficulties with getting enough or getting enough that's of enough quality. What are the potential impacts on your health, or is if putting a bit of time and some thought into improving the quality of your sleep, what can be the health benefits of doing that? The
health benefits, the important thing is that sleep still remains a slightly Cinderella kind of specialty within medicine. And we're rapidly now starting to understand more clearly what the impacts are. So, for example, people who are shift workers and have a disturbed sleep appear to be at increased risk of certain health problems such as heart disease and diabetes. And that's probably due to a disruption of your normal day-night sleep cycle. In people who struggle with insomnia or don't get good quality sleep through the night and maybe wake up regularly for whatever reason, whether there's some anxiety associated or whether it's obstructive sleep apnea, for example, then there are a variety of health problems which seem to be associated, and they include things like possibly heart disease. There's an increased risk of diabetes, and so there's a whole range of health problems that can be associated with disturbed sleep in general life.
And for patients who are participating in the PrepWell programme, they're clearly taking on a range of significant challenges before their operation. They are working to get themselves fitter, they're working to eat healthier, they're working to maybe stop smoking or to control their alcohol intake. Do you think sleeping more and sleeping better is something that would help them in those work too?
Yes, I mean, I think if we think about all of these little components giving us a small amount of benefit. So, for example, if we get a 1% benefit or a 2% benefit from taking regular exercise, 2% benefit from sleeping better, all of these things aren't going to give us a benefit that's one plus the other. They're going to give us a disproportionate benefit by doing these things together. Sleep can be primary. A sleep problem can be primary, in which that is the main problem, or it is usually secondary to other factors. So, for example, in the context that you've just been saying, being anxious about an operation is likely to affect the quality of your sleep, particularly in the days before the operation. We also know that, for example, certain lifestyle behaviours can affect the quality of your sleep. So for example, if you drink alcohol or you smoke, on that night, you are more likely to snore and block your airway and have associated problems because of the relaxation of your muscles during sleep, for example, from alcohol. So taking part in the program and getting support to address or reduce anxiety and improve some of these other lifestyle factors is more than likely to give you a benefit in improving the quality of your sleep, and that will help to reduce the risks when you have an operation.
Brilliant. Thank you very much. One thing I think people often wonder about is how much is enough, or what is a normal night's sleep?
Yeah, we all wonder what a normal night's sleep is, James, and the magic 8 hours is often talked about in the media and on social media. And the answer is that the average sleep for most UK or most adults in the UK is probably between 7 and 8 hours. But there's a whole range of what people need. So, for example, people like Margaret Thatcher and Winston Churchill are notorious for needing less sleep than other people and functioning normally, and other people seem to need 9 or 10 hours. Most people really know what's right for them, and it's not about the length necessarily, it's about the quality of the sleep you have during that time that is as important.
Yeah, I see. So moving on to that then, so if, I think what we're hearing is for the majority of people and adults in the UK, there probably is some room to make some minor improvements to how well we sleep. What would be some practical tips, do you think, for that group of people, as opposed to the people who we can come on to in a moment who are maybe worried that they've got a more specific sleep problem?
So through, in general life, through the sleep clinic, if we are asked this question or we identify a person or a patient who's struggling with sleep, which is secondary to other factors, so to anxiety or maybe disturbed sleep through for other lifestyle factors, we basically suggest what we call sleep hygiene. So sleep hygiene basically is about getting into a regular routine. And we know things like taking regular exercise during the day is beneficial, so we would advise things like that. For people who have disturbed sleep, maybe as a consequence of drinking a little more than we should, we would make recommendations about maybe reducing alcohol before bedtime because of this problem with relaxing muscles and increasing the risk of snoring and sleep disruption. The other things that are important are to avoid things that might stimulate your brain in the lead up to bed. So things like going on a mobile phone or a computer. We recommend maybe trying to avoid that for 2 or 3 hours before sleep. Often people find a benefit in having a warm bath or a shower about an hour or two before bedtime. And the reason that helps is because the onset of sleep coincides with the reduction in your body temperature. So you can almost override that by having a bath and then, of course, a warm bath, and then your body temperature will drop, and that will help to induce sleep. Other things that are important are to make sure that the room that you sleep in is well ventilated, so it's cool and not too warm. It's dark, because we need a dark environment to sleep. That there's not too much noise. So particularly as we come into the spring and the summer, there's more light if we don't have good blackout blinds and so on. So simple things like wearing earplugs and even wearing blackout masks that you can buy fairly cheaply on the internet and can be very helpful in promoting a good quality sleep. So they're simple kind of lifestyle techniques that people can benefit from. And people will be able to find more information on that on our website and our patient information leaflet.
Yeah, so some really helpful and hopefully easy to apply tips that people can try for them. So what about the smaller group of patients? Maybe those people who really feel they do sleep very badly, and they're more worried that they might have a problem along the lines of what you described earlier, something like obstructive sleep apnea or a formal kind of sleep disorder.
Yeah, so for people who have possibly have a sleep disorder, then usually people will either know from a partner that sleeps with them, or they'll know themselves if they're not sleeping well. So for somebody who feels that they have a sleep disorder, in the PrepWell program and participation, they can raise that with us. And if we feel that that is a problem, then we can clearly make referrals to appropriate specialists. So we have a sleep clinic at South Tees that would be accessible for patients who are participating. For people who don't want to go down that route, they can make an appointment to see their GP and can discuss the sleep problem with their GP. But you know, it's a friendly environment, that's why we're here. PrepWell is not all about sleep. Sleep is a component of PrepWell and is one of the factors that we see as being highly important. So we will assess people who bring this to our attention and support them in the best way that works for them.
So Jerry, just building on some of that discussion around this idea of sleep hygiene, are there any resources that we can signpost patients to who are looking to maybe improve their sleep hygiene around bedtime?
There are a lot of resources, and as I've alluded to, there is some information on our website. But I think particularly for people who want a higher level of support for secondary insomnia, which might be secondary to anxiety around surgery, or just some people, you know, struggle with mood otherwise, which can affect their sleep. And there's really good self-referral resources online. For example, SleepStation is available, which is a self-referral, self-help guide for people with sleep disorders and insomnia. And that kind of provides a cognitive behavioural platform for people to get support. And it's been shown to be very effective, and it's actually been developed by sleep specialists in the north of England. So yes, there are a lot of resources available, and we can provide people in the programme with additional information on if they want to request that.
Okay, great. Thank you very much, and we'll provide the details for accessing that. Just to finish, then we always like to ask any top tips for patients in the PrepWell programme when it comes to sleep to end with.
Yeah, so top tips is always an interesting one. I think the first top tip I would say is if you feel that you're not sleeping well, that you should bring that to the attention of our team, because unless we have that information, we would not be able to help, but we would like to help. I think the second top tip is, given that most sleep-related problems are secondary to other factors, as I've said, and the common factor here is going to be around the anxiety of having an operation, because it is a stressful time in somebody's life, to work with us to practice good sleep hygiene. And some of the things I've already talked about in relation to that. And also we can signpost people to other resources like SleepStation. And if you think you've got another underlying condition, for example, like sleep apnea, and just remind people the main symptoms of that are snoring, a partner telling you stop breathing at night, and also struggling with significant sleepiness during the daytime when you should be awake, then you would either go to your GP or bring that to our attention, and we could make appropriate assessments and referrals to sleep teams as required. So they're my kind of top tips.
Fantastic. That's a great note to finish on. Thank you very much.